We intend to take a full and complete look at the Abizaid report. This is why the panel was put in place. Our focus is...
And we will break away here and take you live back to the Senate as they return from their party lunches. Live coverage here on C-SPAN 2. The Senate comes back into a quorum call, and while they are, we can continue to show you the briefing live from the Pentagon here on C-SPAN 2.
8 to move forward to a new place. And the Abizaid panel offers even additional ideas on how we may improve performance and provide options to families going forward. So our focus is on the recommendations in the Abizaid panel. We intend to review them fully, but the focus is today going forward, and that's where we're focused.
We've been aware of other, as you put it, deficiencies, but this one, to my knowledge, has not been mentioned publicly prior to this. I mean, you consider this to be an inappropriate disposition of remains, and when did you become aware of it?
I would just say we haven't had a chance to fully absorb all the findings, conclusions, all the details in the Abizaid report. But they highlighted recommendations that we are focused on implementing, and our intention is to move forward from here.
But surely, Mr. Secretary, you must know, because the Air Force would have had to participate in this investigation, whether those 9/11 remains were disposed of through the Dover mortuary. And I guess that's the question.
Let me just say that the Chief and I and the IG investigations that we'd undertaken to date have not gone back to this period. So.
But you're not taking issue with that finding in the Abizaid report that 9/11, some unidentified remains from 9/11 victims were disposed of at the Dover mortuary?
We haven't had a chance to review all the details and appendices and sources of material that the panel pulled together. That's why they were pulled together. That's why the panel was established to kind of work through these issues. And I think the history that the panel provides is a good context for a long-standing series of problems and challenges in executing this mission. So I think it adds context to the recommendations the panel has made for how to correct and continue to improve our processes going forward. And that's where we're focused.
I mean, at a previous Air Force press conference, we were told that the records only went back to 2008 or a few years before that. So, but somehow the Abizaid panel has gotten access to records that go back substantially longer, a decade or more. I mean, how is that possible?
I'd just say we haven't had a chance to review all the details behind the appendices and all the material that the panel has pulled together.
Are you actually questioning what's in the report? You can't even confirm what's in the records from your own Air Force?
We haven't had a chance to review all of the records of the panel and understand completely where the information came from. So we'll go into all of this in more depth going forward.
Your answer to whether you approve of this practice that's outlined in the report is that you don't know if it happened or you're not aware of it?
Elizabeth, you got the report before we did. We've both been on Capitol Hill for the last 4 hours. Allow us at least the opportunity to go through the report ourselves.
But I mean, your answer suggests that you never did. I mean, for whatever reason, that may be perfectly logical, but that you had not until now been aware of this, is what you seem to be saying, both of you.
That's what I'm saying.
Okay, it wasn't clear from the Secretary's answer.
Mr.
Can I just ask you? It's confusing to me what role the Army plays with the with mortuary operations.
Sure.
What's your understanding, and what's that going to be as you move forward?
Well, I think this is why it's important that we continue to work with OSD and our service partners in this effort. There are 4 different organizations involved in supporting the AFMAO mission. There is AFMAO and the Port Mortuary operation there at Dover. But they are supported at that location by the Armed Forces Medical Examiner, AFME, which is, for which the Army is the executive agent. And that organization actually reports to an Army medical command. In addition, there is a Joint Personnel Effects Depot, an organization that manages the personal effects not only of the fallen, but also of wounded personnel or other U.S. nationals or other sort of operations in which U.S. personnel were unable to take ownership of their personal effects. So there is that depot. That reports to a separate organization as well. And a fourth element of the mission is the service liaison officers who are assigned by the Army, Navy, Marine Corps, and of course the Air Force to serve as liaisons to the depot and to be liaisons with the family. Those liaison officers report to their respective services, and they get training that is different, perhaps across services. So the point of General Abizaid's finding here is that there is more than one service involved in this work. There is an executive agent. There is a Joint Mortuary Affairs Board that is intended to oversee this work and to develop the policies and procedures that provide for commonality and coordination of the seams between these organizations as they perform the mortuary work together. So I think that is, an important finding from the panel. That is a good description of what it takes to perform this mission.
Can I just ask a quick follow-up? The medical examiners were bracked to Dover. Could that have possibly caused some of the problems and confusion that have been persisting in the command?
Well, maybe the chief has some additional insights. I would say that the activity level at Dover and some of the challenges we faced and managing operations there did relate to the change in organizational structure there, the arrival of the Armed Forces Medical Examiner mission changes there, construction programs. AFMEA was very busy during that period. And here, unlike in a civil organization where the county coroner is at one location and a funeral home is at another location, these two organizations are side by side, and working the seams and the accountability of remains with these two organizations intermingled had been a challenge.
Gentlemen, you've been looking at the whistleblower complaints, the OSC complaints, the review of the discipline. When you ordered your earlier investigations, how far back did you ask people to look? Are you today satisfied with that, or do you think the Air Force needs to do a fuller accounting of the last decade of problems at AFMEO and Dover?
Well, the Air Force IG investigation and the OSC investigations were focused on the allegations made by the whistleblowers concerning current operations at Dover. That was our focus.
So, but my question today is, do you think a fuller, backward, historical accounting of the problems or potential problems is necessary, or is that counterproductive?
I think we'll make that judgment after we've had a chance to take in the full scope of the panel's record.
Mr. Secretary, if I could ask you to clarify something. You mentioned that you had a review team regarding the whistleblowers, former officials you appointed to provide an independent assessment. And you said they came back to you and said the actions taken last summer were legal, appropriate, and well within the bounds of reasonableness. When was that they came back to you?
This was in the December-January time frame.
So I guess a number of people in Congress are upset that the Air Force has not taken stronger disciplinary action against some supervisors at Dover. So, you didn't fire anybody the first round. You had other former officials review it, tell you that what you did was appropriate. And now it's taken another Office of Special Counsel investigation to find that potential reprisals were in fact taken against the whistleblowers. Have you been slow to recognize the seriousness of how the whistleblowers were treated by their supervisors?
No. The answer to that is no, because the Office of Special Counsel investigation on reprisals was conducted separately from the Air Force IG investigation, so we had no inside knowledge of how that investigation would proceed or when it would conclude. But we always knew that OSC had a separate investigation going, and that when it delivered its results, we may have additional action to take.
Could I get a clarification, Mr. Secretary, and perhaps you, General? Understanding that perhaps you haven't had a chance to look at the Abizaid report, but in regard to the portion where it talks about the remains from 9/11 from the Pentagon and Shanksville were disposed of in a landfill, were both of you totally unaware of that previously? Did it take you by surprise? Is this the first you're hearing of it, or were you aware of that?
This is new information to me.
And in your opening statement, you called the handling of the nation's war dead a sacred mission. Yet the Abizaid report found that there was an inadequate command structure. Orphaned is what he called it. And you two would know better than I, but my experience is if there's no adequate command structure, the people responsible think the leadership is not taking this seriously. And therefore, it could lead to mistakes like this. General, can you speak to that?
General Abizaid's point is that we did not have a commander working for a commander. And the arrangement that we have had since the early part of 2009 has the commander at the Mortuary Affairs Office working for a staff officer here in Washington. And his point is that that's not the ideal arrangement. In other words, to have a field commander working for the air staff. Fair point. The issue for us at the time was that this was a significant enough mission that there was a sense that it needed to have Washington involvement and attention. And therefore, there was a choice to put the supervision under our collective supervision. His point is there needs to be a command chain, and we take his point, and we're in the process of deciding where that two-star numbered Air Force equivalent command should reside and what the arrangement would be. But again, these are matters of judgment. His recommendation is that there needs to be not a commander working for a staff officer, but a commander working for a commander, and we'll make that happen.
Do you believe that the command structure was adequate?
I think certainly during our tenure, I believe it was. But again, we asked for the best advice that John Abizaid and his panel could provide. We accept that advice. I know the Secretary of Defense does, and we'll act accordingly, sir.
So let's go to Courtney and then Chris, you get the last question.
Well, with all due respect, General Schwartz, General Abizaid, he called it dysfunctional, isolated, and orphaned. Who should have been responsible during your tenure for recognizing that there was this lack of oversight at Dover? I mean, at a place where there should be monumental respect and attention paid to it. Which
you're looking at him. Me. I'm responsible.
But I think I've made the point before, if I might interject here, that I don't think, given the circumstances, the sensitive nature of this mission, and how it is conducted within the confines of a very small organization, a subset of what is already a very small organization, we would not have heard of these problems were it not for the whistleblowers going outside the organization. I think General Abizaid's point was commander working for a commander gives the internal workforce an option of where to report trouble up the chain of command that is a little bit perhaps more approachable or more available than it is if it's a headquarters staff in Washington. So I think that's was part of General Abizaid's thinking.
Mr. Secretary, now that you have been made aware
See this briefing in its entirety online at cspan.org. Back live now to the Senate floor.
If they were cremated at Dover.
Well, senators have returned from their weekly party policy lunches, and this afternoon we are expecting more work on transportation programs and projects. Actually, we are expecting comments from Majority Leader Reid about whether or not they've been able to work out agreement on amendments to the transportation bill. So we expect a possibility of more work on that this afternoon. In the meantime, a quorum call continuing in the House, on the Senate. Live coverage here on C-SPAN 2. As we wait for deliberations to continue, senators are working behind the scenes to find a compromise on allowing amendments to the surface transportation bill. We are understanding this afternoon that some agreement may have been reached, and we hope to get the details from Majority Leader Reid when he takes to the podium. He is there at the bottom of your screen on the left, sitting down in front of the podium. A little bit later this afternoon, the Majority Leader will be joined by Minority Leader Mitch McConnell and members of House and Senate leadership. They'll be taking part in a ceremonial marker unveiling ceremony, recognizing the contributions of African Americans who helped to build the U.S. Capitol. We are recording that event, and we'll have it later on our schedule. It'll also be available in the C-SPAN video library.
be dispensed with.
The Majority Leader.
I ask unanimous consent the call of quorum be terminated.
Without objection.
Mr. President, would you state the pending business?
The pending business is S. 1813, which the clerk will report.
Calendar number 311, S-1813, a bill to reauthorize federal aid highway and highway safety construction programs and for other purposes.
Mr. President, at the beginning of this month, in fact, February 7th, I moved to proceed to the surface transportation bill that's before us today. An extremely important bill, a bipartisan bill led by two fine senators, one quite progressive, the other very conservative. Senators Boxer and Inhofe, the chairman and ranking member of that important committee, Environment and Public Works. This is a vital job-creating measure. The bill would create or maintain up to 2.8 million jobs. And on February 9th, 2 days after I moved to this bill, the Senate voted 85-11 to invoke cloture on the motion to proceed. The bill has broad bipartisan support. But immediately after the Senate moved to the bill on February 9th, Senator Blunt asked unanimous consent that it be in order to offer his amendment on contraception and women's health. I was stunned. I couldn't believe this. I said, what's going on here? I objected at the time. I didn't see why this surface transportation jobs bill was the appropriate place for an amendment on contraception and women's health. But the Republican leader and others on the Republican side of the aisle have made very clear that the Senate's not going to be able to move forward on this important surface transportation bill unless we vote on contraception and women's health. My friend, the Republican leader, said it on national TV. On Face the Nation with Bob Schieffer, Senator McConnell said, and I quote, "The issue will not go away," end of quote. So, Mr. President, I believe that it's vital to get this jobs bill done. What's standing in the way is Republicans' insistence on having a vote on a measure that would deny women access to health services like contraception and even prenatal screenings. So after discussing it with numerous senators, I've decided that we should just set up a vote on the Blunt Amendment on contraception and women's health. There's been enough delay on this bill. So we'll have a vote on this Blunt Amendment on Thursday. After that, we hope to be able to work out an agreement to have votes on number of non-germane amendments on each side, and maybe we'll need some side-by-sides. The Republicans might need some side-by-sides on our amendments. That's fine. Let's move forward. Meanwhile, the managers have made tremendous progress on clearing more than 25 agreed-to amendments. I know the managers want to work on clearing even additional germane amendments. So I believe that this process will be the most constructive way to move the bill forward. I hope that we can put this in, this will help us be placed in a position to work through the complete transportation bill by the end of next week. So, Mr. President, I ask unanimous consent that it be in order for the Blunt Amendment number 1520 to be called up, that on Thursday, March 1st, at a time to be determined by the Majority Leader after consultation with the Republican Leader, the Senate proceed to vote in relation to the Blunt Amendment. Further, that no other amendments be in order prior to the vote in relation to the Blunt Amendment.
Is there objection? Without objection, so ordered.
Mr. President.
Senator from California.
Mr. President, as the Majority Leader is leaving the floor, I'm just pleased that he's decided to take us forward on this highway bill. And he has something more to add.
In the rush to get back to my office, Mr. President, I failed to call up the Blunt Amendment. I'd like to do that.
The clerk will report.
The Senator from Nevada, Mr. Reed, for Mr. Blunt and others, proposes an amendment number 1520 to amendment number 1730.
As further reading, the amendment be waived.
Objection. Without objection.
Mr. President, I ask unanimous consent that my remarks not interfere with the free flow of thought from the Majority Leader, and that my remarks begin after his final comments here on this bill.
Without objection.
Thank you so much. So where do we stand? We're in a situation in the 21st century where, in order to move forward on a highway bill that funds our highways, our roads, our bridges, our transit systems, in order to move forward on that jobs bill, where 2.8 million jobs are at stake in this great nation, we have to have a vote on birth control. I just want to say to my friends on the other side of the aisle, what are you thinking? But if this is what you want to do, fine. And I want to make it clear to the people who are listening that the Blunt Amendment not only would say that any insurance company and any employer for any reason could deny coverage to their employees, it's not just about birth control, it's any service. Now, Mr. President, you serve proudly on the Health Committee, and I guess it's called the HELP Committee now, and you were very instrumental in working through the essential services that are covered, the preventive services that are covered, and it's very important that we note what those are. We have a list of the essential services and the preventive services, and what I'm going to do is read them. And as I read them, I want people who are listening to this to think about whether these services are important and to understand that under the Blunt Amendment, any one of these services can be denied by any employer, any insurance company, for any reason. So I'm going to list these services. Emergency services, hospitalization, maternity and newborn care, mental health treatment, preventive and wellness services, pediatric services, prescription drugs, ambulatory patient services, rehabilitative services and devices, and laboratory services. That's the categories of essential health benefits that this Senate voted to make sure are covered under insurance plans. That's the law. The Blunt Amendment would allow any insurer and any employer to deny any of these services for any reason. All they have to say is they have a moral objection. So let's take maternity and newborn care. If somebody works for you and they're not married and they are pregnant and are having this child, you can say, from now on, I'm not covering anybody who works for me who isn't married. That's an example, because I have a moral objection. Mental health treatment, you could say, I don't consider this a disease. I think if God decided that somebody has mental health problems, that's just the way it is. I deny that. It goes on and on. Emergency services. If some employer believes that if you have a heart attack, it's God's will, that's their moral belief, that's it. They can deny that kind of coverage. Now we go to preventive health, and I'm going to read these. The Blunt Amendment would also say that any employer, any insurance company can deny any of these benefits to anybody at any time. So listen to these services, Mr. President, which came again out of your committee here. Breast cancer screenings. Maybe an employer doesn't believe that's necessary. They could deny it. Cervical cancer screenings, hepatitis A and B vaccines, measles, mumps vaccine. You know, there's some controversy over vaccines. Somebody could say, well, I have a moral problem. I'm not going to offer these vaccines in my plan. Colorectal cancer screenings. Mr. President, we found out that those save lives, a huge number of lives. They say the death rates are going down from colorectal cancer screenings by 50%. An employer or an insurance company could deny that kind of screening. Diabetes screening, cholesterol screening, blood pressure screening, obesity screening, tobacco cessation, autism screening, hearing screening for newborns, sickle cell screening for newborns, fluoride supplements, tuberculosis testing, depression screening, osteoporosis screening, flu vaccines for children and the elderly, contraception. That's what started all this. Contraception. By the way, 15% of women who take contraceptives take it to prevent cancer, to prevent debilitating monthly pain, and it is even taken to prevent serious skin problems that are very debilitating. But no mention of that in the Blunt Amendment. No, no. HIV screening, STD screening, HPV testing, well woman visits, breastfeeding support, domestic violence screening, and gestational diabetes screening, which is the kind of diabetes you get, some women get when they are pregnant. So, here's where we are. The Blunt Amendment would take this list of preventive health benefits, this list of essential health benefits, and send a very clear, unequivocal message to every insurer in this country and every employer, and says, regardless of any other laws, if you decide you have a moral objection or religious objection, you do not have to offer this coverage. Remember what we're talking about here. We're talking about coverage. We're not saying that people have to do all these things. If I have an objection to doing any of these things as an employee, I don't have to do it, but I have coverage if I decide to do it. That's the beauty of the health care bill that we passed. It says, here's essential health benefits, here's preventive health benefits. Employers and insurers, you have to offer this coverage. If people want to take it, they can. And what will happen is good. Now, when you hear the other side describe the Blunt Amendment, they will not tell you what it is. But I have a very clear take on what it is because I've printed it up, Mr. President. And here it says, a health plan shall not be considered to have failed to provide the essential health benefits package described in subsection A or preventive health services described in section 2713 if they decide they have a moral or religious objection. That's the basis of it. And so you take that and you say, okay, here are the essential health benefits. They no longer have any meaning. Here is the list of preventive health benefits, and those are at the whim of the employer, the whim of the insurance company. And it is really, it's disturbing. You know, Mr. President, you have a great career in your life, and you're a great senator now, and before that you told a lot of great stories and a lot of great jokes. And I have to tell you that Jon Stewart took this issue on and said, well, I'll tell you something. I love the Blunt Amendment because he says, I'm an employer and I believe that humor is the best medicine, he said. Humor is the best medicine, he said. So he said, so that's what I'm going to do. He said, I have an example here. And then this guy comes onto the stage with a very bad cold and flu, and he's sneezing, and he says, Mr. Stewart, do I have to have another treatment now? He says, yes, and he takes a seltzer bottle, and he sprays it all over the guy. That was his treatment because it was funny, and he was supposed to laugh, and that was supposed to cure this person. And he said, not another treatment. And so, you know, in the darkest moments, one finds consolation in humor. But just think about there are people who believe and have a strong moral and religious conviction that they don't want to take medicine. They just believe they're in the hands of God, and I personally respect it 100%. And people died for their right to have that view, and I think that's appropriate. We should respect religion, everybody's religion. So the way to deal with that is, if that individual doesn't want to ever be treated, that's their choice. But frankly, if they put a child's life at risk who has cancer, and we've had cases like this in America, where a parent said, I don't believe in medicine, and a child could be cured with some cancer treatment, people stepped in and said, we're going to make sure the child gets treatment. So all we're saying in our health care bill is, here's the list of essential health services and preventive health services that scientists and doctors have told us will save our families pain and suffering and costs and all the rest, and we make them available through the insurer and the employer. That's all. People don't have to take them, but they're available. Under the Blunt Amendment, if your boss happens to be a person that doesn't believe in medicine, he can just say, sorry, I'm not a believer, and you can have an insurance plan that may have nothing behind it. No services. None of these services that we worked so hard to put into the law. So it is stunning that in this year we would be standing here on a highway bill anticipating a vote on Thursday on an amendment that has to do with women's health. There's a lot of concern out there because we saw when this whole thing started that there was a hearing in the House of Representatives. Do we have a picture of that with us? Where they had a panel on women's health. They had a panel that dealt with especially access to birth control. Not one woman was on the panel, on that panel. And the men decided that it was wrong that women should have access to birth control without a copay. Even when the doctors and the scientists had said it is so important, when our families are planned, what happens? There are fewer abortions. It's not even arguable. Fewer abortions. I would think we could be in agreement on that. Fewer problems for our families, economic problems, when they plan their families. Now, if you don't want to plan your family, that's just fine. You don't have to take that coverage. You don't have to take that contraception. So the President, in his decision, I thought struck a great compromise. What he said was, because the experts, the medical experts, the Institute of Medicine told us that contraception is a very important choice for people because 15% of them use it not just for birth control, but to fight disease, cancer, and cysts on their ovaries and such. Because that's important, we put it in this list of essential benefits, preventive benefits, but if you're a church, you don't have to offer it to your employees. That's what the President said. And there are 335,000 religious institutions that are exempted from having to offer this through insurance. The religious affiliated hospitals and universities were uncomfortable because they wanted to be able to not be directly connected to the contraceptions, and the President struck what I thought was a really good compromise. Everyone applauded it. Catholic Charities applauded it, Mr. President. The Catholic Health Association applauded it. They represent thousands of providers. Catholics United applauded it, and the bishops were still unhappy. But the institutions that provide the service felt the President struck a good bargain. So we were all pleased. We thought this is fine because everybody's religious freedom should be respected, and that's what the President did. But now we have the Blunt Amendment. And not only does this open up a Pandora's box, it opens up a very dangerous policy. It allows insurers and employers to simply say they have a moral problem with something and they don't have to offer a list of services. Maybe they do it because they really have a moral conviction, but you can't really prove it. Maybe they do it because they want to save some money. We don't know. But it opens up a very bad situation. We have to table or beat this Blunt Amendment. It's very, very dangerous. And how about having it on a highway bill? I still can't get over it. When I first heard about it, I thought, what does it have to do with highways? Maybe it says you can't take a birth control pill when you're driving on a highway. I mean, there was no connection, and there is no connection. But the majority leader is right to get a vote on this. I'll tell you why. It's holding up our highway bill. We can't get off dead center. We've been on this bill days, and we can't get off dead center because my Republican friends want to vote on contraception and women's health care on a highway bill. So we're going to do it, and hopefully that will signal our goodwill to move forward with this bill. 2.8 million jobs are at stake. Our bridges are in desperate need of fixing. We have 70,000 bridges. I think, is that the right number? 70,000 bridges is the right number that are in very bad condition, and 50% of our roads are not up to the standard they should be. And we've had stories of bridges crumbling, we've had stories of highways in trouble, and I'd say to my friend, I'm winding down from my remarks at this point. So we shouldn't be stuck on this bill. I could proudly say that Senator Inhofe and I worked in the most remarkable bipartisan way to get a great bill out of our committee. The Banking Committee did the same, Senators Johnson and Shelby. The Commerce Committee got a little stuck, but they're getting unstuck, and we're moving forward on that piece, and Finance has done an excellent job of finding the funds for us to fill the trust fund. Mr. President, I want you to think in your mind's eye of a football stadium that hosts the Super Bowl. Think of what it looks like when it's jam-packed with people. It's about 100,000 seats, right? 15 of those stadiums could be filled with unemployed construction workers. So think about what that would look like. 15 Super Bowl stadiums sold out, every seat filled. That's how many unemployed construction workers we have because of the housing crisis. This bill will put them back to work. In a bipartisan fashion, we have protected the 1.8 million jobs, and we create up to another million jobs. So I can't believe we're discussing birth control on a highway bill, but such is life. That's the way it is. If that's what we need to move this bill forward, I'm happy. If we have to move on some other issues that are not germane to the bill, I'm even willing to do that, because that's really what is at stake here. What is at stake are construction jobs. What is at stake are falling bridges. I mean, I don't have to tell my friend the effect of a falling bridge. We know it happens. Senator Inhofe is eloquent on the point that he lost a constituent who was taking a walk, and a huge piece of a bridge fell and killed her. I mean, this is not the way to run a country that is the #1 economic power in the world. And I'll tell you, if we want to stay the #1 economic power in the world, we can't be stuck in traffic and have all that congestion. And it's billions of hours and billions of dollars lost because we're not keeping up with what the image that was painted for us by Dwight Eisenhower way back when I was a kid, when he said, we need to have a network of highways that run seamlessly across our nation and connect us one to the other, a national highway system. And we can't lose that vision. We can't. There are some people who say, oh, why do we need a national system? Let's just have the states do it. No, this is one nation under God, indivisible. We need to be connected. When the imports come in from all the various countries, from the Asian nations into Los Angeles, and 40% of our imports come in there, we take those and we put them on those trains, buses, trains and trucks, and they get shipped out all across America to every state in the Union. They go. And that's commerce. That's called commerce, interstate commerce. So we need the roads to be ready, willing, and able to take that kind of traffic, and not have a situation where so much is added to the cost of transport because there's so much congestion that we begin to lose our effectiveness as an economic power. And that's, frankly, where we are, because not only do we import, but we export. So we've got to take those exports and get them to the various coasts, the East Coast, the West Coast. We have a lot of opportunity to go to the Gulf Coast. So if we don't keep up with this national system of highways, we're in trouble. And this is a great bill. This bill is a reform bill. We take it down from a lot of titles to, a couple of dozen titles. We don't overspend. We keep spending at current levels. The Finance Committee has done its job to help us fill the trust fund for 2 years. And last point I'd make before yielding the floor, because I know my friend from Georgia's here. He is my very good friend, and I know he has some remarks he might have on another subject, or on this one, or another subject. And he's going to talk to me as the chairman. Okay, so we have some work we want to do. So I'm going to close it here. But what I want to say is this is really close to an emergency, and I don't overstate it. The entire transportation program expires, Mr. President, on March the 31st. That means all of our states are going to be hit with an end of a program that's essential to their people, to their businesses, and that's why we have 1,000 organizations representing millions of people, from the Chambers of Commerce to the AFL-CIO, to the granite people, to the cement people, to the general contractors. I mean, seriously, the AAA, it goes on and on from A to Z, 1,000 organizations that are behind our bill. And they're not going to look kindly on a situation that we could come to, which is that we don't have a bill. And you can't just extend this bill, because the money is not in the trust fund anymore. It's not like past years where you could extend it. The money's not in the trust fund. So if we have to cut a third, we're talking about hundreds of thousands of workers that will be laid off. So, Mr. President, I want to again thank the Majority Leader Reid, because he's getting us off center here. He's getting us off that line. We're moving forward. And I ask unanimous consent that the following staff of the Finance Committee be allowed on the Senate floor for the duration of the debate on S. 1813. Harun Dogal, Avital Barnea, Elizabeth Snyder, Christopher Tusanovich, Andrea Chapman, Amanda Bartman, Claire Green. And I ask unanimous consent that there be no motions in